from. My name is Calvin Pugh, and I serve as a senior advisor on community engagement for the International Association of Providers of AIDS Care. I'm humbled to be moderating this session, Human First Zero HIV Stigma Day documentary. I'll share a few words, we'll watch the film together, and following, I had the great fortune of being joined by some of my friends, Alid, James, and Damian, to have a conversation following the film. I encourage you, as all of the moderators today have done so, is if you have questions for our cast or about the film, please put them in the Q&A feature in the bottom of the toolbar of your screen, and we'll answer as many as we can get to. It is very late where Alid and James are, so we'll try to not take too terribly many. I want to thank the incredible team at Howard, Dr. Rana, Patty, of course, and the rest of the team who faithfully put this conference on every year, addressing a topic that not only affects individuals, but also challenges our collective humanity, the stigma surrounding HIV and other health conditions. Stigma is a formidable adversary in the fight against HIV. It breeds silence and perpetuates discrimination. It casts a dark shadow over the lives of those affected, hindering their ability to seek support, access treatment, and live free of judgment. It's not only a barrier to health, but a roadblock to compassion, understanding, and progress. I believe it's far past time to redefine the narrative surrounding people living with and affected by HIV, and collectively around other health conditions. It's time to replace ignorance with knowledge, fear with empathy, and judgment with acceptance. It is a collective responsibility that requires education, compassion, and a commitment to fostering an inclusive environment. But we have to be the agents for change, breaking down the walls of misconception and building bridges of understanding. Each one of us has the power to make that change, to challenge stereotypes, to dispel myths, and create a society where every person, regardless of their health conditions, is treated with dignity, respect, and ultimately to be seen as human first. When we were planning for the inaugural Zero HIV Stigma Day for July 21st of this year, we wanted a theme that resonated with what I believe is one of the most great challenges of our time today, recognizing the humanity in ourselves and each other. We ultimately landed on Human First to coincide with the 75th anniversary of the Universal Declaration on Human Rights. We were inspired to create what you're about to see, focusing on the stories and the experiences of 6 incredible individuals from around the world who, while we share those stories, we also want to highlight some of the best practices, some of the solutions that are being implemented around the world to reduce stigma related to HIV. I am so fortunate. I feel very grateful to share this film with you and the conversation with the cast following. I, on behalf of the International Association of Providers of AIDS Care and the Fast Track Cities Institute, proudly present Human First. You can roll the film.
Some of what I've heard, it's a little scary. It's confusing, and some of it is a little reassuring. Some of it, I think if people got the facts and understood exactly what AIDS was and the difference, then maybe it would help.
We're all scared to death. We'd like to know what the hell we're supposed to do here. You know, what should we do? Should we stay home and lock ourselves back in the closet, or, you know, what should we do?
And how about unsafe sex with one girl?
Absolutely no risk, man.
And another?
No risk.
Another?
No risk.
And another?
Definitely no risk. No, 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 no.
I'm sorry. You love
What?
Over the past 4 decades of the HIV epidemic, HIV stigma has been persistent and destructive, fraying the fabric of human connections that make up communities.
There was this prime time TV advert of this tombstone that kind of falls and crumbles.
We're talking about the 80s, you know, 80s, early 90s. It was a stark contrast between how white gay men were portrayed and how black women were portrayed. How she was described in media was prostitute, she was turning tricks for some crack.
I understand this is not a woman's disease. tell that to the 16,000 women who have it. They use drugs, and they do perverted things.
You get HIV, you die. You get HIV, you get AIDS, you die. It was always that cycle. Yeah, it's very hard to talk about this.
As quiet and obscure as a whisper, or as loud and violent as a protest, stigma reduces us to something less than human. The definition of stigma is straightforward, a mark of disgrace associated with a particular circumstance, quality, or person. But uncovering stigma and addressing it at its roots is far more complicated.
People are still being blamed for getting HIV. People are still being criticized for engaging in sex at all. How are they able to accept themselves if society and the places that are supposed to be safe for them are not safe?
HIV stigma involves a set of negative attitudes and beliefs about people living with or affected by HIV. It is the prejudice that comes with labeling an individual as part of a group that society deems socially unacceptable. As a concept, it sounds abstract, but for so many, it is a daily lived experience.
I got taken to another room where they were going to do a second test to confirm, while sat there being like, oh my God, how is this going to affect my life? They put a biohazard sticker, which they obviously needed to, but I just sat there being like, oh, I'm a biohazard now. Great.
We all want to be accepted, especially when you are from a community that is hugely impacted by ignorance and bigotry and lack of love and understanding.
Nearly 3/4 of people living with HIV recently surveyed in the United Kingdom reported having experienced stigma due to their HIV status.
I have heard stories where people have received stigma at work, which has resulted in them losing their job, losing their house, having to live in their car, becoming unwell, and having no income.
In South Africa, where 1 in 9 people live with HIV, employer discrimination is widespread and rampant, with some companies dismissing workers living with HIV or hiring those believed to have a low risk of infection.
Companies require people to do an HIV test, and if it comes out positive, they sometimes don't get the job. A lot of people don't even know that is why they did not get the job.
And in the United States, people of color account for about 66% of new HIV infections, with the greatest burden borne by African Americans and Latinos. They are made vulnerable to HIV by inequity and racism alongside stigma.
In the US, for example, HIV impacts disproportionately Black African American men and also Latino men. We have to address the social and economic disparities, and that also entails addressing racism as a public health threat.
Since the start of the epidemic, HIV stigma has fueled new HIV infections and age-related deaths. It is still doing so today. In healthcare settings, stigma is impeding access to and the use of HIV testing, prevention, treatment, care, and social support services.
I've been in situations where my doctor was someone who was full of implicit bias and who was heavy on the stereotypes. If I don't trust my doctor, it can have severe implications and complications with my health care.
But it extends well beyond the healthcare sector. It is found in every aspect of social life, domestic and community environment, educational and workplace settings, and within the justice system.
HIV is not just a disease of the body. It also touches poverty. It touches unemployment. It touches drug and alcohol abuse. So if we don't attend to the structural drivers of HIV, then we will not win the war on HIV.
The Joint United Nations Programme on HIV and AIDS, or UNAIDS, has set a benchmark that by the year 2030, less than 10% of people living with HIV and their affected communities experience stigma and discrimination. If we do not strive to bring that number closer to zero HIV stigma, if we lower the bar and accept the world as it is, we miss an opportunity to shatter the status quo, denying people around the globe the right to dignity, health, and well-being. But this story is not about data or defeat. This is a story about being human first.
I am James Oladipo, a clinical social worker and researcher working with the Richita Project.
I am Lydia Joyce McNeil. I bring you greetings for the beautiful city of Grit and Grind. That's Memphis, Tennessee.
I'm Alid. I am 35. I use he, him pronouns, and I live in Bristol in the UK.
My name is Victoria Cordova. I am from Argentina. I'm a trans woman. I'm also Latina. I'm an immigrant.
My name is Zonke Ndlovu. I live in Kwamashu, a small township outside Durban in KZN, South Africa.
I'm Damian Cabrera, and I am born and raised in Puerto Rico, and I am an HIV advocate living in San Juan.
My biggest fear was that I was never going to have a relationship or sex again, and I'd never have any friends because they would all think that I'm disgusting and they'd run away from me. Like, I had just visions of the blob. Like, it's gone in me, it's now going to swallow my friends, it's now going to take over my life, and it's going to ruin everything.
When I left the hospital with the HIV diagnosis, I thought that my life was going to end. The memories of the friends that I lost in the 90s came to my mind. I couldn't tell anyone for 14 years.
A lot of culture and religion, especially in Africa, are still very conservative. So things like sex amongst young people, amongst unmarried people, is still seen as problematic or seen as immoral.
As a country, we were facing a lot of people who were sick and who were dying. And people just became scared of coming out.
While stigma can manifest at various levels, in this documentary, we are focusing on 3 forms of stigma: institutionalized, interpersonal, and self-stigma or internalized stigma. Institutionalized stigma is systemic, involving government policy, organizations, and healthcare systems that intentionally or unintentionally marginalize people living with HIV.
Where I fetch my medication, there are 2 clinics. There is an old clinic that we were using before, and then there is a newly built clinic, which is a very beautiful clinic. People who are living with HIV, TB, mental health, we still go to the old clinic. So there is that segregation of patients. Most of the people I know are fetching treatment outside Kwamashu. They have to pay a lot of money just to go to fetch their medication because they are scared. Someone will see them, they'll recognize them, and then their status would be known in the community. You feel the eyes of the people and you feel like everyone knows my status.
These structures that, for example, are there to support you and to provide healthcare to you have their own bias. One of the biggest barriers to accessing PrEP is provider stigma. They feel that by prescribing you with PrEP, they are giving you permission to have condomless sex or to be promiscuous. By having their own bias and their own stigma, many providers deprive you from the tools that you need to protect yourself from HIV.
You see nurses telling people living with HIV that I did not tell you to go get HIV. I did not tell you to do this. I did not tell you to do that. Why do you engage in things like anal sex? Why are you sleeping with other men? Or why do you engage in sex work? All of you that are here for your HIV medication, come to this queue. That's people's statuses being disclosed without their permission. And what that means in some instances is people disengaging from care. People would tell us that I'd rather not go there. I'd rather not take the medication. The clinics are supposed to be safe spaces for people where they expect to be treated with respect, and we just keep leaving the country behind.
I've been in situations where my doctor was someone who was full of implicit bias and who was heavy on the stereotypes. If I don't trust my doctor, I'm not able to fully advocate for myself, and that leads to a lack of self-efficacy. You know, when we have those conversations, I want to meet your trainings, I want to meet your education, free of your implicit bias.
Interpersonal stigma arises when someone discredits, devalues, or shames someone because of perceived differences. It can lead to isolation, rejection, marginalization, and discrimination.
People living with HIV don't have to worry about their status alone. They also have to worry about disclosure. Things like rejection, loss of employment, sometimes violence from partners, from family members. They get kicked out of the house.
One of my cousins was sick, and she didn't even tell us what was wrong with her. They were told she was bewitched. Some others said she needed to do some rituals, which we did. A week later, she died.
You start seeing conversations on social media, and you start seeing how your friends react to HIV unprompted, right? It became very loud. One of the things that came up was like, you know, if Black women stopped having sex with gay men, they wouldn't get HIV. If they weren't so promiscuous, if they didn't do this and third, they wouldn't get HIV. Or God is punishing you, pour bleach on them and these type of things. And so when you see that play out, it's hard not to internalize it.
Not only with HIV, but when you are a different person from the LGBTQ community, you experience rejections from an early age. So for me, like trying to find a love, someone who I want them to love me, and then they said, oh no, you are HIV positive, I can't be with you. It was so hard for me to disclose because I was an immigrant, I was a trans woman, I was HIV, so there was a lot of layers.
And I've had numerous messages sent to me on various dating apps. I'm murdering my community. It's people like me that deserve to have HIV. You shouldn't be looking for sex. Why are you on here? You're dirty. Instant blocks. But I like an instant block because I just see it as the trash taking out themselves.
One of the folks that we were interviewing shared this story about how he shared his status with his family, and he was put into a different room, and that he had different set of plates, glasses, everything just for him.
Self-stigma is perhaps the most insidious of all. When we hear negative messages, we internalize shame, develop low self-esteem, and at worst, give up entirely.
A lot of studies have shown how there's a connection between living with HIV and mental health issues. In social circles where they refer to people living with HIV as unclean, people start to see themselves as unclean. If you see yourself as unclean, why take a medication to want you to feel better? And it leads to issues like suicide ideation, to depression, to anxiety, ultimately just disengaging from care.
The first thought I had was, who marries someone who's HIV positive? My inner critic got real loud. My inner coach got muted. How do I navigate this to keep this a secret? And you ain't always got the time to try to navigate this secretly. Like, I went into isolation. I didn't think I could trust anybody. I kept a note in my phone because I was like, if anybody finds out, it's one of these people that told. When I went to go see case managers, I just parked in a different part because I didn't want to be seen walking into that building because that building is stigmatized. You know what I'm saying? That building is stereotyped as those who got HIV go over there. So I had my story together because I'm a sorority girl. I got sorority plates on the back of my car. So if it was ever, oh, Lydia, we saw you. Oh, girl, you know, I was doing, you know, my community service. I was there for philanthropic efforts. And it's like you putting on a personality that's not true to who you are. And you no longer get to live in your genuineness or your authenticity. Damn. You know, that's how powerful that shit is. Because of that secrecy that impacts your mental. And whatever impacts your mental and your emotional impacts you in your health. So all this stuff is a 360.
You know, I couldn't tell anyone for 14 years until last December when I realized I don't want to carry on with this any longer. You know, the average lifespan for a trans person in Latin America is 35 years old. You know, I will be 52 in 2 weeks, so it's a milestone for someone coming from that region of the world. If I am here helping other members of my community, how can I keep this to myself? I can't.
When dealing with stigma, fear is never the answer. And fear-based campaigns are definitely not effective, not empowering. What are the messages that the community needs to hear, in what language, what visuals? And that's exactly what we were trying to do at the Gay Men of Color Fellowship, which is a program that I manage in my current work. The Gay Men of Color Fellowship gathers 20 gay men of color across the US and Puerto Rico to develop a social media campaign based on their voices. They are the experts on their experiences, and they are the ones that understand the language that community uses, the messages that the community needs. One of the Gay Men of Color fellows, Andres, he has been putting out his own messages, sharing his experiences around HIV as a person living with HIV. I feel lucky to be able to be surrounded by people that are so passionate.
So for a long time, I just thought that I was okay. Like if someone said, "What do you think of this coat?" and I went, "It's okay," I'm usually asking for another option here. So I had all of those images of kind of death, illness, and old people going through my head. So I then was like, let's take my mind off it and let's enter this drag competition. This will be cute. That kind of started my drag journey. I always say that I fell into drag by accident, but I've always used my platform or that moment with a mic to press an issue or to raise a point. So if I'm on stage and I've got people literally hanging on by a lash to everything that I'm saying, and I can sandwich a fact or a point in between a joke, then hopefully by remembering the joke, they remember the fact.
So I planned an event called Moment of Transparency, and that was my coming out party. We had a logo, we had swag bags, we sold tickets, we had DJs. It was in a venue, we had food. It was a whole vibe, right? A mini film festival, community event, and a panel of like community people. And I was like, let's go. The moderator for the panel knew. And once the film ended, his first question was like, how do you see yourself in the movie? And then it got to me, and I said, I am someone who has been diagnosed with HIV. I was diagnosed a year ago today, and this is my first time saying it out loud. Whole room got quiet. You literally like could hear, like a mouse piss on cotton.
I have 3 daughters. When they reach puberty, I had to sit them down at different times. Started with my old one, and I told her that I was HIV positive. I also told her that she shouldn't be scared. I told them how I take my medication. I just said to them, you just need to make sure that your mother takes medication every day, and then I'm not going anywhere. My 27-year-old, she was 3 when I was diagnosed with HIV. She was 3 years old. Oh, and now she's a lawyer.
All these layers of stigma are at the end of the day deeply intertwined. Together, they diminish our sense of humanity. Stigma wants us to believe we are different. We are other. We do not belong.
These different types of stigma, they are all interconnected. It's like a network that's been fed by so many sides. And that in the end, what it leads is to dehumanize us and to make us look as we are less than we are.
In 2023, 42 years after the first reported cases of HIV, we have the tools at our disposal to avert most new HIV infections and avoid all AIDS-related deaths. So why are we off track to end AIDS as a public health threat by 2030? HIV stigma is a primary culprit, keeping people from knowing their status, accessing prevention services, starting on treatment, and realizing their rights to health. The good news? Fast-track cities are implementing community-driven, evidence-based interventions designed specifically to end institutional, interpersonal, and self-stigma. The London Anti-Stigma Charter is an initiative to make London a city with zero tolerance to HIV stigma. It is a critical tool in addressing institutional and societal stigma and aims to ensure that institutions and the services they provide are welcoming to people living with HIV.
The Anti-Stigma Charter is basically going into places of employment, and if you're like a gold badge HIV confident organization, that means that all of your policies and your procedures are great and you're making a concerted effort to make sure that people living with HIV in your organization are seen, are valued, and are safe to work there, delivering training to staff, writing new policies, changing different procedures, and promoting the fact that you are a diverse and inclusive employer.
The foundations of Clinic Q is to fight HIV and stigma, and we're also part of the Stigma Walk. We marched 2 months ago through London. We are aligned with the Anti-Stigma Charter. Discrimination can happen very behind the curtains, so you will never know. I usually work for people who know me or I know them and I know that it's going to be safe for me. But the unemployment for trans people is huge. So first of all, you need to get a job. And then if you are happy to get the job, the managers and the boss, they need to have some training regarding trans people and non-binary people. And then if we go for people who are HIV, I think that every company needs to have a training, and it's very important that managers deliver this sort of training. It's crucial to minimize, as I said, the stigma regarding us.
One act of stigma at work can have a dramatic negative impact on someone's life. When I first got diagnosed, I didn't know whether anyone would want to employ me. I didn't know whether I legally had to tell my employer. So to see this come in, it's really important for positive people, and it would have been really important for me at the time. I'm really excited and I'm really looking forward to kind of the impact and the change that this could have, because then they can become allies, and we love an ally.
Status neutrality is an approach to HIV prevention and care service delivery that emphasizes high-quality care to engage and retain people in services and de-emphasizes whether an individual is HIV positive or negative.
Status neutrality is understanding that if you're a person that is sexually active, you have an HIV status, whether it is positive or negative, but you do have an HIV status. If you are a person that tested positive, that means that you should engage in care and that the systems should be there to support you. If you are negative, there's also care that has to be related to that to keep you negative. Whether you're positive or negative, there is care associated to your status. The status neutrality, for me, is key to ending the HIV epidemic.
I always say that it's going to take all of us, irrespective of your HIV status. Even if you receive, a HIV negative diagnosis, you still have a part to play in ending the epidemic, for lack of better words. So imagine you're someone who's received an HIV negative diagnosis. You've educated yourself. You know what PrEP and PEP is. You know about, treatment as prevention. You're educated about the modes of transmission. You're igniting fires and normalizing the conversations. And it takes a burden and a load off of us who are HIV positive to have to always be in the forefront and leading the conversation. As we introduce new methods, my sincerest hope and prayer is that there is not an erasure of folks that show up in this world like me. Cisgendered, heterosexual, Black, HIV positive woman.
Undetectable equals untransmittable refers to the result of multiple studies that confirm a person living with HIV who is taking antiretroviral therapy or ART as prescribed and reaches an undetectable level of virus in their blood cannot transmit HIV to their sexual partners. The risk is 0.
U equals to U is undetectable equals untransmittable. When someone that is living with HIV is on treatment, they adhere to the treatment, they become virally suppressed. And what that means is that they can no longer transmit the virus to someone else. Working in this field, I get to speak about the findings of the work that we do. In the recently concluded SA8 conference, there was a presentation in the closing session around the state of U equals to U in the country. The campaign is kicking off in some of the provinces across the country, and they are hoping that there's more awareness around it. It's starting to change conversation. They can still go ahead to marry someone that is HIV negative and have kids, lead normal life. They'll see life. They will believe there's a future for them and that they can still live a normal life.
Undetectable equals to untransmittable. Wow. It's a new term in South Africa. One that we're still getting used to. But it's a very nice ring to it. Wow, now why should someone stigmatize me? I'm just like everyone else. I'm untransmittable, I'm undetectable. At the moment we are using a tool, a conversation map. We're using it to do a treatment literacy. It just makes everything clear. When I talk about a child, there's a child in the conversation map. When I talk about a couple, there's a couple in the conversation map. They could actually see and visualize the community they are in. It's become interactive and it becomes fun. So it was very exciting showing people on the conversation map, saying this is my journey. I mean, I came from a viral load of 10 million copies. Now it's undetectable, so it's possible for all of us. I actually divided my kids and said to my other one, you gotta take this one and you gotta take that one. I really thought I was going to die, but here I am today.
The Universal Declaration of Human Rights recognizes that the inherent dignity and equal and inalienable right of all members of the human family is the foundation of freedom, justice, and peace in the world. The Declaration also enshrines the right to health and well-being within the context of universal respect for and observance of human rights. Ending HIV stigma requires defending the human rights of all people against intolerance, inequality, and invisibility, a concept both universal and individual. Actioning a future with zero HIV stigma translates simply into every one of us being treated, viewed, and respected as human first.
The first letter of HIV is human. Behind every statistic, behind every piece of data, there is a human being there who is living with, who is having the struggle, who is fighting the fight, is going through their journey. we as positive people are much more than our status. We are family members, we are loved ones, we're partners, we're colleagues, we're workforce. We are fully fledged human beings with so much more to give.
You might have, yes, a lot of people that are experts in science, that are experts in medicine. But if you don't include those that are experts in their own experiences, there's going to be a huge gap.
One of the successful campaigns that I've seen my organization run is the HIV Positive campaign. HIV Positive is printed in bold on t-shirts, on jerseys, and that everyone wears, whether someone living with HIV or not. This helps to break the social stigma, seeing the people first. You can walk around with a t-shirt that boldly says HIV Positive, with no one looking at you funny, with no one seeing you as weird or someone that is going to die.
We're all part of a network, probably sometimes disconnected. We need to connect the dots. Before I'm a trans woman, I'm human. I am human before being Latina, and I'm human before being HIV positive.
As a Black person, before you know about my HIV diagnosis, you see the color of my skin, right? It's almost like the cry that we have when we say Black Lives Matter. Like, do you not see my humanity? First and foremost, before anything, it seems simple, but simple ain't always easy, right?
I am a friend.
I'm a mother.
I am a trans woman.
I am a brother.
I am a PrEP advocate and user.
I am a sister, a daughter, an auntie, dog mom, and just all around fabulous Black girl who's magical.
I am a drag queen.
I am a person living with HIV.
I am Latina.
I am a researcher.
I am a proud member of Zeta Phi Beta Sorority Incorporated.
Soy orgulloso puertorriqueño.
I am a person living with HIV.
I'm a survivor.
Yo soy humano. I am human.
I am human.
I'm human.
I'm human, period.
Well, I don't know how about the rest of you all, but that always gets to me. I'd like to acknowledge Victoria Cordova, Zonki, and Lydia, who were not able to join us today. We had the great fortune of working across 3 different regions in the world, and I have luckily have some great friends across the world who have joined me tonight, despite the late hour. I am pleased to be joined today by Alan Osborne, by James, and Damian. I thank you all for joining me. Would you like to introduce yourselves and let them know where you're coming, where you live, and maybe what time it is there?
I'll go. I'm Alid Osborne. I'm from Bristol in the UK, and currently it is 20 to 1 in the morning. So we are living the dream. But hello, everyone. Great to be here.
Can you hear me? Oh yeah, I am James Oladipo. I work and live in Johannesburg, South Africa, but I'm currently in Pietermaritzburg. It is 2:42 a.m. So it's nice to be here. Like Calvin said, every time we watch this, it always evokes that emotion, and it just reassures us that we did the right thing to speak up about HIV stigma.
Yeah, I agree. Hello, everyone. Damian Cabrera from Puerto Rico, San Juan, and happy to be here. And here is 8:30, so it's not that bad. I'm fine. Good to see you all. Happy to be here.
I don't know about you, Damian, but the older I get, the closer it gets to 7, the sooner I want to go to bed.
I mean, I had coffee.
Oh, I have not had coffee. So let's jump in real quick. So what motivated each of you to be a part of Human First and share your personal or work experiences?
I think I'll go first. I think for me, it was like, why not? I especially something that Ladia said earlier in the movie is around where you hear people around you talk about HIV and you see how what they say directly or indirectly perpetuates HIV stigma. It is something that, one needs to speak up about. So if I can add my voice to, how to the little part, to do a little bit in ending HIV stigma, I see the negative effects in the work I do every day in the lives of people living with HIV, with people I know personally. And so it was just a thing of what like there was not a reason not to. I've seen the direct and indirect consequences of HIV stigma, and it is affecting people's life, and that's why I liked, when I heard the name of the movie Human First, it was about like, yes, finally, let's put people living with HIV first. Let's put the human first before the actual virus.
Yeah, agreed. I've had direct stigma and indirect stigma directly towards me, and I'm lucky enough that I'm privileged enough that I've been able to deal with my diagnosis in the way that I have been able to, and not many people in Bristol. Like I know so many people that don't have that voice, or aren't, or don't feel comfortable enough to be able to talk about it. So I'm in that position, and people look to me, people look at me, and I think it was another case of like, why wouldn't I speak up about it? Not only is it going to change my life, but it's going to change the 1,000 people living in Bristol that are diagnosed with HIV, let alone the undiagnosed. And it is just that thing of putting us back. Like everyone living with HIV has so much more to give. And like 90% of us are undetectable anyway. So we've got so much more to give you than our HIV because we can't, even if we tried, and I've tried very hard multiple times. But it's, yeah, we just need the science. Well, we just need society to catch up with the science. And this is just another beautiful way of being able to do that.
Yeah, and I decided to join this project because it makes sense, right? Because sometimes we either have like a super clinical conversation, or we're talking about, I don't know, like medication or prep, but sometimes the conversation about stigma is just left behind. And if we don't address stigma and the different levels of stigma as it was portrayed on the documentary, we are never going to end the HIV epidemic. And also the approach of the documentary of featuring the experiences of people around the globe, for me was like, okay, this is something that I had to jump in, just because, first I would like for people to learn more about the Puerto Rican experience, but I would also love to learn more about the experience of James and Alec and other cast members. So, yeah.
Yeah, agreed. And like, just to add in, you could give me the best antiretrovirals in the world, whether that's one pill once a day, whether that's a bi-monthly injection, whether that's a 6-month implant, or whatever they're going to come up with next. You can give me all of that. But if I'm not actually living my life, if I'm not actually surviving, if I'm not thriving, and I'm not living my life, I'm not going out there, I'm not integrated in my communities, I'm not at work, I haven't got my family, I haven't got meaningful relationships, those meds are redundant. Because yes, medically I'm not going to be dying, but socially I am. And that is what is then the potential additional impact of stigma. It's that isolation. The risk of suicide increases by 3 within the first 2 years of somebody's diagnosis, and that is all stigma related. So we have to end it if we are going to end HIV, full stop.
I couldn't agree more. The audience has asked you to speak up a little bit, if you can do so without waking your roommate. It is the middle of the night there.
I just take my microphone up, so hopefully that will help.
So can all of you give me an instance of either how stigma affected you personally, or someone close to you, or someone in your work?
Well, I think for me, there's a lot of examples I can give you, but I think very similar to what Zonke said in the documentary around exclusion of or segregation of people living with HIV, even in health institutes. People living with HIV are made to queue to be on separate queues. They are made to use separate lines. It's that social exclusion or segregation of people living with HIV. On TV every day, you get specialized or different life policy advertisement for people living with HIV. That means you can't get the mainstream life policy. You can just things that are so basic, and then between individuals, Aled mentioned about what happens on social media and around queer people, around Black people, around young people, around where they tell you, oh, you're living with HIV, then no, it's like we don't want to be around you, we don't want to see you. So these are things that I witness daily in work, amongst friends. So it is something that we need to start speaking about so that we can save the next person. Because there are quite a lot of people, I also like that Alec mentioned privilege. Like some of us are privileged, to be able to withstand it or might not experience some of the stigma, but some people don't. Their status gets disclosed even without their consent, and that stigma just perpetuates. Zonke also mentioned about having to travel very far to different clinics. That's what I see every day because they don't want people in their community. They can't use their community clinics because they don't want people to find out about their statuses. So they want to go very far because they know what would happen if community members do find out that they are someone living with HIV.
Yeah, I've got numerous examples. Like for myself, I used to work behind a bar. One of the customers went up to the owner of the bar and asked the owner if it was safe for me to work there, just in case any glass, like as I was washing glasses, they smashed and then my blood would go everywhere. There was a rumor going around that I was purposely going around cutting myself and spraying the customers in the bar. I was on a night out and I was having a fun time with a boy that was in the bar, and an older member of the community took the opportunity when I went to the bathroom to go up to that boy and say to him, like, be careful with Alid. Do you know what he's living with? Is that something that you want to get into? And we had barely kissed at this point, let alone discussed whether I was taking him home. Luckily, there was a drag queen who was my friend performing on stage at the time, and I gave her that look that only two drag queens can give each other. And then she handed me the mic, and he left the bar, and me and the boys stayed in the bar, and everybody else stood on their feet. In terms of clients that I've had, we had a migrant client come over from a Caribbean island who was diagnosed with HIV because of corrective rape because she was a lesbian. We've had incidences, even not that long ago, of one of our clients at Brigstow being admitted into hospital and then having really damaging and poor healthcare from healthcare professionals because on the board outside her door, they wrote HIV positive contamination risk, which prevented healthcare workers and assistants going into her room to top up her water, to make sure that she was filling out her menu cards for food. I could go on and on about examples of stigma, but they're probably the extreme end and some personal ones.
Yeah, I can also think about stories of stigma as they relate to culture in the sense that we don't talk enough about sexuality, or sexuality is approached, or sex is approached as a as a taboo or something that you do in private, right? And I've known stories of people living with HIV who have delayed being on care because they don't want first, they don't want to deal with this situation, and also they don't want to see other people see them going to places that people know that here in Puerto Rico people living with HIV go to access services. Also, as the story that I mentioned in the documentary, that was when I was working at the University of Puerto Rico in a research team. That really, really struck me because, that was probably like 3 years ago, 4 years ago, maybe. Um, and how still these perceptions from the 80s and 90s are still present in so many people. And it's just one of those stories that, that stay with you. And also related to PrEP stigma, there are many, many stories, and I would say that the main one is I have a friend actually that he is currently on PrEP, and but he told me, like I delayed being on PrEP because I had this perception that people that were on PrEP were promiscuous, although I was having multiple sexual partners. Um, so at the same time, it's like it takes people to deconstruct these ideas. And it's hard because we get fed these ideas by so many sides, like whether it's like education, family, media, the government. And it's really hard to kind of break them down and realize, I'm doing this for my sexual health. Yeah, those are just some of the examples, but I would say that many of them really relate to how we perceive sexuality and how culture plays a role in it.
Oh, like 100%. And it's when you get diagnosed and you never thought it was like it would happen to you. And because you have been fed these images or this narrative of what people living with HIV are supposed to look like, and you don't look like them or you don't act like them, and you used to think the same, and then bam, you're now living with it as well. And so not only are you trying to deal with living with HIV, but you're also dealing with how you start to view yourself and other people living with HIV from switching to what you thought of it before. And that stems from sexuality, behaviors, promiscuity, slut shaming culture, and that narrative. Um, so yeah, I completely agree. And when we then look in the UK as well and like bring it back here, 1 in 10 people living with HIV have have not accessed healthcare when they've needed it because of fear of discrimination and stigma from healthcare providers. 1 in 10.
Yeah, just to jump in on that around a very close friend of mine would always ask, why is there still so much HIV stigma? And I would always tell him, because it would be like, why is there HIV stigma when there are other, chronic illnesses that people face, and they're open to talk about it. Someone has cancer, they can talk about it. But then I tell him it's because HIV is in most countries, in especially in Africa, HIV is tied to sex, and sex is seen as immoral. And when you look at that, that's the, like you said, the shame that comes with it. So, like, how did you get HIV? You understand? Forgetting that there's other ways. You spoke about your clients now that was, yes, it was true sex, but it was corrective rape. It was yes, I have participants in our research program, that got HIV through drug use, through different other through accidents, even while using protection, through condom bust, through denial of services. So there are different ways in which people get HIV, but the fact that the sexual part is what is more prominent and more common, and the fact that people, conservative religion, cultures, and all that still sees sex, especially around unmarried people, as something that is immoral. So it also continues to foster the stigma and shame, and also the different levels in terms of even internalized stigma, whereby people living with HIV themselves, cannot talk about it, they can't disclose, they can't start medication because of the shame that comes with HIV.
Yeah, I think it's wild to me that today that we live in a world where puritanical and colonialism are still ruling our sex lives. Like, mind your business. So how do you hope that what you contributed to Human First changes some public perception?
I think probably what motivated me, to be honest, like I just want, it's what I said in the film, like the H in HIV stands for human. And behind every story of stigma, behind every data, behind every research study of 85%, 1 in 3, 1 in 5, 1 in 4, behind every drugs trial, there is a human there, and that human is a functioning member of society. They are a mother, a parent, a child, a sibling, a relative, a work member, a a a partner, and we need to treat with them with humanity, um, just as we would treat everybody else. So I just hope that in this film, or the impact of this film, people can just understand that there isn't the one narrative of HIV. Every single person is an individual, and get to know the individual, get to know them, get to make connections with them, and then treat us how, like, just treat us like you would any other human. Like, you don't need to worry about our HIV. We know about it. Like, we're probably the most engaged cohort with any health condition. We know more about it than you. Um, so, yeah, just see us as Alid and James and Damien and Calvin and Victoria and Zonky and Lydia, because that's who we are and that's what makes us special. The HIV is just a bonus at that point.
Um, I, I, I think for me, seeing how the documentary is being shown in different spaces. I recently got a text from a trans woman that we had worked with on our data collection drive, sending me a screenshot that we are sitting in the workshop on U equals to U, and they're showing the documentary. I was like, yay! So just getting to see the actually the individual, that young queer person that just got a diagnosis, seeing the documentary and feeling, okay, there is hope for me. There are people, out there hearing, touching stories like Zonke's, things like that are what I hope my contribution or participation in the documentary would be, to start to impact individuals, and also both people living with HIV and those that are not, to start to understand their role in HIV stigma and how it affects people. Here, seeing that this is this is people's life that we are, with true stigma we might be messing with. So, and hoping to save one person else from that, going through all that experience would have been a win for me.
Yeah, in the for me, it's about putting a face to the story, right? Because there's, again, there's this in shifting the narrative, because I still feel like there is this, together with HIV comes a sad story, and it may be sad in many instances, right? But it's not the only narrative. And I think that when people get to see people that are living and thriving with HIV, or that people that are empowered by taking control of their sexual health, um, there's a shift in how they approach HIV, and it's also a way to end stigma, because I feel like if we don't have these conversations, if we and many people don't have the access to have these conversations just because they don't have people in their community that are necessarily informed to engage in this conversation. So I really hope that this documentary sheds some light into, what, as that we are human first before being PrEP users, before being people living with HIV. Um, I really hope that it's something that if there's something that people take away, is that we are human first before anything else.
I'm gonna give one more chance for folks in the audience to pop a question in the chat, and I'm gonna give us one last question. But I would like to go back to one thing that, Alid, I disagree that your most pivotal moment was that. I still think it is the trash took itself out. I have used that so many times. Not too recently, I ran to a former patient that I worked with who said that some boy they were talking to blocked them on Grindr, and I was like, "Oh, honey, the trash just took itself out."
I say it so often, whether it's to friends, my housemate, or even like I ran a Living Well with HIV workshop back in September, like the weekend after Amsterdam, and I showed bits of the video, and we were talking about dating and kind of managing relationships, and yeah, I say it all the time. The trash, I love it when the trash takes itself out because it's one less job for me. But even in general life, like, take the trash out. Either make them do it themselves or you do it. If they're not providing you with anything, just like, we get so hung up with keeping those people or relationships or whatever too close to us, and just get rid. get rid.
So, all of you, is there one thing from the documentary that you want everyone to take away from for themselves personally or to share with others?
I think for me, one thing I learned, and I think that I have been using a lot, especially is around status neutrality, because I feel that is one thing that will, smash HIV stigma. Because when we all know that when you're sexually active, even when you're not sexually active, you're at risk of HIV. You have an HIV status. So whether you take a test or you don't, you have an HIV status. And whether you eventually take a test and it comes out positive, you get into care, treatment. There are pathways for both outcomes. And like Ladea also said, you just taking a test and you meeting a counselor or a nurse or a health practitioner that is warm and welcoming and free of stigma and is able to, educate you about either care or prevention or around just sexual health in general. That enough empowers an individual, irregardless of what the result is. And when you start hearing campaigns like U equals to you, where people living with HIV are put first for once in a campaign, undetectable. That's where we're starting the conversation. You understand? A person living with HIV's health, is fine, when they achieve that status. Before we start talking about transmission or whether they are at risk to someone, that is another thing. So two things which I'm sure they know about, but I would like them to, to take away is status neutrality, U equals to you. Those are two tools that we have right now to fight HIV stigma, and we just need to spread the word.
I think for me, this film just highlights the impact of meaningful, like, lived experience engagement. So, like, when you keep talking about HIV, when you keep talking about stigma, when you keep talking about quality of life or aging or whatever subject matter you're talking about, and you're at a conference or you're doing a research study or you're implementing a new project or service in your clinics or with your nonprofits, when you empower your your lived experience patients and you provide them the space, that's when they're the biggest catalyst for change is themselves. And if you allow them the space to talk, not only will they educate the other professionals that are around you, but they will then empower other members of the community that are just coming into your clinics. And meaningful engagement, reimbursement of volunteer time, reimbursement of lived experience, because you're asking them to talk about their experience that you don't have because you're negative, you know, or you're not taking PrEP or whatever your experience is as a clinician or as a healthcare worker. This is what I've done to engage these communities. But have you asked the communities about how they felt the engagement went? And using a film like this and using a platform like this, it doesn't need to be as grand. It could just be a half an hour. You've got a couple of patients doing a discussion with the consultants about how they feel they are welcomed in clinic. Do they feel that they are heard? Do they feel that they're their own advocate? Whatever. But meaningful lived experience engagement and promoting that, we can never do enough of.
Yeah, I totally agree. I do hope that people take away from this film And again, similar to what Ale was saying about how, you know, science can be super advanced, and hopefully in the future we will see different technologies to prevent and treat HIV. But if community is not involved in that response by telling their stories, by sharing their experiences, we are not going to get very far. Um, and also, I think that it's important to keep talking about status neutrality, because I think, and this is something that I've heard from a couple of my participants at the Gay Men of Color Fellowship, and that is that only people living with HIV are the ones responsible for HIV, right? And people who are not living with HIV don't necessarily they're not held accountable about acquiring HIV. So the only the only responsibility is for people living with HIV. And I feel like status neutrality shift that narrative by telling people that you also have a role in stopping HIV, and you also have a role in your own sexual health. So I think those are my the key things that I hope people take away from this documentary.
I actually couldn't agree with you more, Damian. I think everyone is responsible for their own sexual health, regardless of their HIV status. Well, because it is so late, I appreciate everyone who stayed with us tonight. It's very kind of you. I thank you, Damian. Thank you, James. Thank you, Aled. So for you all joining us in the middle of the night. Thank you to Dr. Rana and Patty again for having us. If you'd like to reach me, it's kpugh@iapac.org. And if you'd like to watch the film again and again and again and again, it is available on IAPAC's YouTube channel and at zerohivstigmaday.org. Thank you so much, and I will see some of you tomorrow. Have a great night, everybody.
Thank you, everyone. Bye.
Bye.